Good morning. Today we are here to present our bibliometric review, which we have done as dual degree students in medicine and healthcare management. Lung cancer poses a significant challenge to the healthcare system, both in Thailand and globally, currently ranking as the second leading cause of cancer-related mortality in the country. With 15.9 deaths per 100,000 people, it is both a high-cost and high-burden disease that demands strategic resource allocation and effective management. This bibliometric review offers the cost-effectiveness of lung cancer treatment in hospitals, providing an in-depth analysis on trends, major schools of thought, and influential research in the field. This study aims to identify the key trends and emerging findings on the cost-effectiveness of lung cancer treatment, as well as offer insights into how resources in lung cancer care has emerged throughout the years and how it may inform future healthcare decisions. In terms of the methodology used, we analyzed 360 documents since 1985 that address lung cancer treatment and financial management from the Scopus database. We then use analytical tools such as Excel and Bibliometric Viewer, which employs both descriptive and advanced bibliometric techniques to visualize similarities between these research identification of schools of thoughts in our co-citation analysis.
So here we come to the results. The first figure you can take a look here, we take a look at the trend of documents by year. As Supicha has already mentioned that we discussed since 1985, but we've seen that there is the spike actually in the 2020 that spiked all the fluctuations every years. But because of in 2020, there was an incident of COVID-19 pandemic. That could be the reason that the authors suspect why there is a spike during that time, which is the correlation with lung cancer treatments. And also trend by the documents by author, we also seen the Liu Xiu and Zheng X and Zhou X, which we have already included the co-authors within this research parameter. And the third figure is the trend and documents by subject areas, which the highest first one is the medicine and coming right after with biochemistry and genetics. The third one is pharmacology and toxicology. Then we're going to see in the trend of documents by country and territories. Here you can see that in China, there is the biggest correlation or the highest document published by the territory. And then coming right after with United States. And then the third one is obviously the United Kingdom.
Okay, so next, the data presented in Figure 5 highlights the top-cited article in this field, The Epidemiology and Cause of Chronic Obstructive Pulmonary Disease by Chapman, published in 2006, ranks first in this category. And the researchers shown in Figure 6 were colleagues of Chapman and also contributed in these articles as well, so they are one of the top-cited authors. Moving on to Figure 7, it reveals that the Milbank Quarterly Journals has the highest citation per document among sources analyzed. And lastly, in Figure 8, this is a co-citation analysis map illustrating the frequency of pairs of authors that were cited together. The map categorized this author into four main school of thought, with the largest and most prominent group focusing specifically on cost-effectiveness analysis of treatment for metastatic non-small cell lung cancer. So, in conclusion, this review offers valuable insights into key contributors and emerging trends, and understanding these patterns is crucial for shaping the future direction of healthcare system development. Thank you very much.
I'm just curious, what is the most cost-effectiveness treatment of lung cancer? Could you give me some hints about this?
Okay, so actually for this research, we mainly look at the trends, but in terms of cost effectiveness, I believe that we have to split in stages because in each stage of lung cancer, the cost effectiveness or the appropriate treatment is different. However, there are research that suggests, as for example, surgery may be a more cost-effectiveness treatment strategy in the long term compared to like chemotherapy. Like it may be more expensive at first, but in the long term, it is more cost-effectiveness for the patient and the hospital.
Mm-hmm. And what is a further research from your study?
Yes. So for the future research, we believe that in the yellow school of thoughts, there could be more research done for the treatment for third stage non-small cell lung cancer. This is because for stage 3, there's a variety of combinations of treatment strategies. For example, moreover, the research could look into emerging treatment strategies such as immunotherapy and targeted therapy as well.
Yes, because it's quite interesting, and I think someone might mention it's just the trend, but you can show the area that is a hot issue, because the lung cancer, we faced with it for more than 50 years. And now we try to identify what the area that we should working on more and maybe improve the quality of life or treatment outcome. Thank you.